Hello there, Dr. Mentz here. This is a quick little case just to demonstrate difference in appearance of a lung tumor in a chest radiograph compared with a CT. So here we have a chest radiograph, and we can look at the lateral view too. Not much to see on that of assistance, although you kind of get a feeling there's something here. But going back to the PA view, you should see that this thing stands out from the other areas of the hilum. So this hilum looks good with vessels, and you have vessels here, and you have this big lump right here in the left upper hilar region. So what is it? Of course, you want to do a CT to get more detail, and here's a CT, and let's scroll up through this. That's down, okay. So let's go back up here, and let's see what we've got. Okay, so here you have that mass, the same mass you saw here, right there. You look at a CT, and you see it here. And if you look at it on a lung window, kind of looks a little bit more like what you might expect based on the chest radiograph. Okay, so anyway, you can really see that mass more clearly. You see the whole perimeter of it all the way around. You see its relation also to some of the pulmonary vascular structures in the hilum. Is it enveloping an artery? Well, partly this one. Is it extending into a bronchus or occluding a bronchus, that kind of thing? Whereas on the chest radiograph, you get a lot of information, but not nearly what you get on that CT. So you see that information, and it really does stand out quite a bit more here on the lung windows. Okay, what else is going on though? Okay, so now if we look at the mediastinum, this is what I want you to see. You look up here, and you have that's a vascular structure, left brachiocephalic vein. But look at these little lumpy things here. Let me zoom in a little bit more on that. Okay, so all of this soft tissue here is adenopathy. See, here's the mass, and it has extended to the nodes in the mediastinum. So here you have an enlarged node, or a couple of them close together. Here's one right here. Let's go up a little higher. Oh, here's another one here, another one here, probably a couple more here. Okay, so you start seeing all of these nodes. Let's go down a little bit farther. Now we look down here, carinal region, right around where about the level where the trachea bifurcates here, actually a little bit above that, or just to the side of it. Here's an enlarged node. Here's an enlarged node there. And it's an example of where the more you look, the more you find. And this may be something else. That looks like it's a hemiazygous vein. Here's esophagus. Okay. All right, let's take a look at the coronal and see if that's at all illuminating. Okay, so here we have. Okay, now you kind of get a gestalt. Now you get a good feeling of you've got this mass in the left upper lobe, upper hilar region, and you start seeing its relationship to this mass of nodes extending in the superior mediastinum there. So you can kind of get a better overall view, and you also get a good correlation between what's going on here in this coronal frontal projection, like this, and what you saw on the chest radiograph here. So you look at that, and you look at this, and you really kind of get a good comparison of the two. In fact, here, if you look at the CT like that, and then you look at the chest radiograph, you get a lot of correlation. So then you can start thinking, well, I know there's adenopathy here, and you think, well, maybe this is a little bit fuller than the aortic arch should be, etc. So it kind of gives you an idea of how much more you can see on CT, but it also gives you an idea when you look at a chest radiograph that you're seeing sometimes just the tip of the iceberg, and especially when it comes to lung cancer, and there could be lots of stuff going on in the mediastinum here that could be very hard to see. And that's it.